Hello and welcome. I'm excited to talk to you today about demystifying Chinese medicine. This is a really important topic to talk about because Chinese medicine has been presented somewhat poorly here in North America, and as a result, we have found ourselves on the fringe of healthcare. And in my humble opinion, Chinese medicine deserves a bigger seat at the healthcare table. And so I'm hoping to provide you with information today that provides clarity about what Chinese medicine actually is about. And I think you'll be surprised to see that it is actually much more in alignment with Western biomedical knowledge than you might have thought. So let's go ahead and get into it. And here we go. So the history of Chinese medicine is that it is one of the world's oldest healing modalities. It is actually traceable back to the beginning of Chinese civilization. This number is been debated, but we're talking about anywhere from 3,000 years to 5,000 years. And the cool thing is it's been practiced consistently that entire time without stopping. It's had many iterations over the millennia. It's always been developed further and further. There have been different schools of thought, but it has been continuously practiced throughout that period. So because it is so old, it does have roots in Chinese shamanism and Taoist philosophy. But I think it's important to know that it is really not an esoteric or a metaphysical type of medicine. So a lot of people, when they come into my clinic, they ask, do I have to believe in Chinese medicine for it to work, or does it contradict with my current religious belief system? And a lot of people are legitimately concerned about that. And I always have to assure them it's not a belief system. You don't have to believe in Chinese medicine. Your body doesn't have a choice but to physiologically respond or not. But the reality is, because it is old and because of some of the language that is used in translation, people have a sense that it is some mysterious, esoteric type of knowledge. So these are just some pictures of the first one. There is Shen Nong. He is a historical figure in herbal medicine. He wrote the first Materia Medica thousands of years ago. He's kind of a legendary, mythical figure almost. And we have some pictures of old doctors taking people's pulses. And then at the bottom, those are some other legendary doctors. You can see in the bottom right, there's Shen Nong again. We also have Hua To and Zhang Zhongjing and the Yellow Emperor. So Chinese medicine, because of this long history, has developed into a highly sophisticated system that was developed over thousands of years of research and empirical practice. That's one thing that I think is poorly understood. It can seem somewhat simple at first outset because, again, of some of the language that we use. But you got to keep in mind that Chinese civilization is pretty amazing when you look into its history. It has made some of the most significant contributions to the world today as we know it. So they are said to be responsible for the four most important inventions in human history. That's the compass, paper, gunpowder, and the printing press. But they also contributed significantly to mathematics, astronomy, natural science, agriculture, mechanics, engineering, metallurgy, naval architecture. They were the first culture to experiment with vaccines. They are responsible for fruit grafting. They created silk and other textiles. I mean, this culture was smart, and they approached human health with the same level of rigor and discipline that they did with any other subject. So, granted, it's thousands of years ago, so technology is somewhat limited. You know, they didn't have X-rays, they didn't have MRIs, they didn't have lab tests or anything like that. So, ancient Chinese doctors used the best tools and research that they had available to them, given the standards of the time. So, what they did is they did post-mortem dissection. Now, this was super taboo. It's during a period of and in a culture of something called Confucianism, where you're supposed to respect your ancestors and you're not supposed to desecrate the human body. So these guys in the middle of the night, behind the shed, they took people after they died and they opened them up and they pulled out all the organs. They measured and weighed the internal organs. They calculated the blood volume of every organ. They determined at what time of day each organ had its most optimal level of functioning. They counted the blood vessels connecting the internal organs, and they traced those blood vessels throughout the entire body, throughout all the tissues and from the organs and whatnot. So this is an ancient anatomical chart. You can see that they knew the place of all the organs and they had named them and documented them. So they really had a comprehensive understanding about the relationships between the internal organs, as well as the relationships of the organs with the body and the mind as a whole. They clearly understood the musculoskeletal system. They had understanding about the circulatory vascular system. They understood the nervous system. They even understood how to manipulate the nervous system in order to affect blood circulation in the body. And that's what we're doing with acupuncture. They also had rudimentary knowledge of the immune system. So this is another anatomical chart. You can see they had identified the spinal cord, the brain, the major arteries coming from the heart. Just really smart people. They use this research to guide their clinical practice. They kept what worked, they got rid of what didn't. And you have to remember, this is the culture that created the printing press and paper making, and they had a cohesive writing system and language. So they documented these findings. They created case studies of patients that they were treating, and they even created institutions of higher learning. So they formalized the knowledge and proliferated it through these institutions. They refined what worked over thousands of years and made it even better. So they just kept building on that knowledge and expanding it further. I mean, it's really cool. In school today, when you go to Chinese medical school, they hand you a textbook and they're like, this was written 2,000 years ago, study it and learn it, and you think, why would I need to read this book? It's outdated. And they're like, no, it's actually relevant to the people you're going to be treating today. So very long history and actually pretty sophisticated, researched medicine. These are some of the ancient books that, are in existence. So pretty cool that it was also documented and proliferated. So the other cool thing is that this is being practiced in a culture and a period of time where the average lifespan is about 60 years of age, which doesn't maybe sound that old to us now, but for the time period is very old. Because of that lengthy lifespan, the medicine was developed with this focus of living a longer, healthier life with less pain, better sleep, less stress, more energy, and more vitality. You also were paying your doctor to keep you well, and you would not pay them if you got sick, which I think is a great healthcare system. I'm not saying that the current system that we have today is designed with any type of ill will or anything like that, but it's just inherent in the way that it's set up that there's really no incentive to get people well, because the medical system continues to make money if you stay sick. So this is also in a culture and a time period that was pretty tumultuous and somewhat dangerous. And so the consequences of not being a very good doctor were pretty significant. So if you wanted to survive, you had to become highly skilled in diagnosis and preventative treatment, because if you were caring for a higher level person in society and they got sick, then they would just cut your head off. So very, very motivated to improve skills and get results. And I think because of this history of longer lifespans and the ability and luxury to focus on living healthier lives, Chinese medicine is more relevant now than ever. So let's say that in my clinic, I see the tools that we have available to us are highly effective for treating about 85% of all health issues. So that's a pretty good outcome. The remaining 15% are best left for surgery or medications. I mean, look, we can't treat everything, you know. A lot of times patients who come in, they're just too far gone. They've had these chronic problems forever and they've degenerated, and you're just not going to be able to treat everything that comes into the clinic. So let's look at this in contrast with Western medicine. Um, Western medicine has roots in ancient Greece, approximately 400 BC. Modern Western medicine that we know today really began to make its most significant advances in the 18th and 19th centuries AD. And at this time, people were dying from plague and poor sanitary conditions, and all of that really contributed to ill health and disease. I mean, there's no running water, there's no plumbing systems. People just threw their garbage and waste out into the street. It drained into the community well. You got pests and rodents, and it was just a difficult time, and you just weren't going to live that long. So the average lifespan at the time was about 30 to 40 years of age, you know, and because of that shortened lifespan, people didn't care how toxic the medication was. Okay, they didn't care how traumatic the surgery was. They just wanted to stay alive long enough to reproduce and maybe watch your kids grow up a little bit. So it's because of this history that Western medicine really developed into becoming a reactive medicine. You know, something had to be wrong to such a degree that it required a significant intervention like surgery or toxic medication. So these are just some pictures of medicine being practiced in ancient Greece, and then medicine developing in the 18th, 17th, and 18th and 19th centuries AD. So they were starting to experiment with anesthesia and surgery, and they were using lots of interesting substances as pharmaceuticals. So let's look at this in comparison to the Chinese view of health. So I mentioned that Western medicine developed into becoming this reactive kind of medicine, whereas Chinese medicine really developed into being a preventative medicine, you know, paying your doctor to keep you well. So in Chinese medicine, we view health as a balanced interaction between three different physiological aspects of the human body. So those are qi, blood, and the internal organ system. So I want to talk about each one of these things today, and I'm going to spend more time on the first word because it's this word that has maybe caused us the most issues as far as Chinese medicine and its place at the healthcare table. So this word qi was mistranslated in the early 1900s by this gentleman, George Morant. He was a Jesuit missionary that had gone to China to do some academic work. And at that time, he was exposed to Chinese medicine. And he was just absolutely amazed and impressed at the level of knowledge, skill, and clinical results that he was witnessing, that he decided to dedicate the rest of his life to translating Chinese medical textbooks into French. And at that time, he translated this word qi as energy. And at that moment, he changed the direction of Chinese medicine for the Western world, because Chinese medicine went from being this highly scientific, researched, and empirically practiced medicine to becoming categorized as an energetic form of medicine. And it was so detrimental to our status as Chinese medical doctors that this energetic style of Chinese medicine continues to be propagated today in most English-speaking Chinese medical schools and is practiced by the majority of English-speaking practitioners. And there's this interesting thing that has happened as well, in that even Chinese medical doctors in China, when talking to English-speaking practitioners, will use the word energy to translate qi, when over there that's not their understanding of it. It's just this weird redaction that happens. So the issue is that this is not exactly what ancient Chinese doctors were talking about. The word qi is not directly translatable into English. And the problem with the word energy is that it's just too big. It just doesn't mean anything to anybody. There's no substance to it. And so it becomes like this invisible thing. And that just doesn't work for Western medical scientists and physicians. So we really want to know what it means. We have to break down and examine the Chinese character. So it has two different parts. And the first parts are these lines on top here. And those lines are really best described as vital breath, gas, or vapor. And then the second thing we have are these lines on the bottom here, these little things, and that really means cooked rice. So they're saying that the air that you breathe and the food that you eat will create qi in the human body. So that's a little bit better, I think, but it's still not quite good enough. So you should understand that this idea, it actually has a physiological basis explainable by our understanding of the human body in modern Western science. So the vital breath, gas, or vapor is best correlated with oxygen, because they were saying in Chinese medicine that you're taking this air qi in and transforming it into resources that your body could use. So oxygen is a much better word to use because it's consistent with our understanding about our environment and how our body works. It also includes other gases. Something that not a lot of regular people know about is that our body has these gases in our body that signal to tissue, cells, and internal organs. And we have another gas called nitric oxide. And that, I think, can be included in the translation as well. The cooked rice is really more about assimilation and absorption of nutrients from our food. So we take in these nutrients from our food and absorb them, and then use those nutrients as building blocks for other physiological resources like blood, hormones, enzymes, so on and so forth. So that is a little bit more substantial. So qi really is the air that you breathe and the food that you eat. And if you really want to get further into it, we know through biology something called the Krebs cycle, that our body and our cells actually take in these nutrients and the oxygen, and they use those substances to create a substance called adenosine triphosphate, which is actually an energy molecule. So qi can also be thought of as ATP being produced by the cell. So another word that Mr. Morant also mistranslated was the word mai. He used the word meridian, and I really don't like this word because it's much like the word qi. It doesn't really bring to your mind anything of substance. A meridian is a term that's used in the nautical world, and it doesn't really apply to the human body. So if you start saying that you have these meridians, which don't correlate with anything, and this invisible substance, floating through these imaginary pathways, it's no wonder that Chinese medicine is on the fringe of healthcare. It sounds pretty weird, but the word I like better for mai instead of meridian would be vessel. So if you just lay these meridian charts over a modern Western anatomical chart, you'll see they actually pretty closely correlate with our vascular system and the nervous system, the lymphatic system. And we're finding today that our with increased knowledge that they actually also closely correlate with the fascia. So a meridian really is a functional organization of tissue, including the blood vessels, the nervous system, the lymphatic system, and even the fascia. And I think as we progress in our understanding of the human body, we'll see that start to come together, that all of these tissues are related and that there actually are functional relationships and communicative pathways between those tissues. The next fundamental substance in Chinese medicine besides qi is blood. And this one's a lot easier because it really has pretty much the same function in Chinese medicine that it does in Western medicine. We say that it's warming, nourishing, moistening. It is responsible for transporting oxygen, nutrients, hormones, enzymes, endogenous anti-inflammatories, pain relievers, white blood cells. Chinese medicine didn't use those terms, but they did talk about how blood had different components. There was a nutritive component, and they did talk about its nourishing, moistening, and warming function. And both healthcare systems agree that blood circulation is, healthy blood circulation is absolutely vital to proper health and functioning. The third fundamental aspect of health in Chinese medicine are the internal organs. So this is kind of an interesting subject because we have the same internal organs in Chinese medicine as we have in Western medicine, but it's important to keep in mind that the perspective of those organs are very different in Chinese medicine. So in my clinic, I often talk about people's organ function. Maybe I'll say the word, liver or spleen, and sometimes people get really nervous or anxious because they're concerned that they're actually having a Western medical organ issue, and in some cases they are, but in a lot of cases they're having less significant of an issue because of these very different perspectives. So in Chinese medicine, the organs are not only the anatomical tissues of the organ, but they're also the metabolic and functional relationships between the organs and each other, as well as your body and your mind as a whole. So this is just a comparison. You can see another ancient anatomical chart. They knew about the organs, and they perfectly line up with the Western medical knowledge that we have. Interestingly enough, in Chinese medicine, we do actually have some organs that are not classified in Western medicine. But I think, again, as we start to learn more about the human body and have a better understanding, some of these things will come to light later. So in Chinese medicine, the internal organs, they really need to be physiological, balanced, and supportive of each other's function. They're like a musical group. If they're all playing at the right speed and the right volume, it sounds absolutely fantastic. And if one person is off or playing the wrong note, or the rhythm gets off time, then you really have a cacophony. So imbalance in one organ will lead imbalance to others, and that's how complicated conditions start. So Chinese medicine has the ability through this millennia of practice, research, and documentation to understand these complications clearly and then develop strategies for correcting these imbalances. Okay, so we have the three fundamental aspects of health. We have qi, we have blood, and we have our internal organ systems, and then we have the vessels connecting all of these things. So you have to have enough blood flowing to your internal organs so that they are nourished, and you have to have enough oxygen flowing to those organs so that they can function. And when the internal organs are nourished and functioning properly, they'll create enough blood. And when they're nourished and functioning properly, they'll metabolize oxygen and other gases as well. You have to have enough oxygen and nitric oxide to saturate the blood, and you have to have enough blood to move those gases through the body. So when those three things are in alignment and balance, then you have something that Chinese medicine likes to call optimal health. Now, I can say that word optimal health, and a lot of people are like, great, what is that? So I want to try to talk to you a little bit about what that is, because I find in my clinic that most people are confused about what their health should look like because the standard in Western medicine is so low. So from the Chinese medical perspective, optimal health means that your mind and your body are functioning at the highest level possible. And when you are functioning at your most optimal level, you sleep well and feel rested in the morning. You know, you fall asleep easily, you don't wake up, you sleep through the night, and when you wake up in the morning, you jump out of bed, you're excited for your day. Your energy is sufficient, you know, to live your life the way you want. You are able to go to work, come home, and you still have enough gas in the tank that you can do the things that you want to do. Spend time with your family, engage in your hobbies, interests, and you just have this vitality. You don't need to amp it up with caffeine or whatever. So digestion is good. That means that you have a healthy appetite. You don't want to eat too much. You don't want to eat too little. And when you eat, you don't have any belching, bloating, gas, indigestion, heartburn, acid reflux, nausea, vomiting, or anything like that. Okay? Your elimination is healthy. You urinate regularly. It's easy. There's no problem starting or stopping urination. You have regular bowel movements anywhere from 1 to 3 times a day. When you do have a bowel movement, it's well formed, about the consistency of a banana. There's no blood, mucus, undigested food in the stool. There's no hemorrhoids, burning pain. There's no straining when defecating. Your emotions should be balanced. That means that you experience all of them, but they are proportionate and appropriate to the situation. Okay? There's no excessive anxiety, worry, outbursts of anger, depression, or anything like that. You can feel those things, but again, they should be proportionate and appropriate to the situation. This one's interesting. It gets people a lot. You shouldn't have pain. You know, pain is a feedback mechanism that something's wrong. So if you do have pain, it's not nagging. It doesn't become chronic. It goes away. You know, you heal quickly and recover. Your immune system, it should be strong and resilient. So no allergies, no frequently getting colds or flus. You just really have a lot of resilience. And you should have healthy reproductive function. So that means that you have a good drive, good libido, you know, you have desire, and you have the function to execute. So these are just some of the things, you know, the list could go on, but that's pretty much the gist of it. So the question for you is, how many people do you know who have optimal health? And I'm going to make the assumption that you don't know as many as you should. And the reason for that is that these 3 fundamental aspects of health that we've discussed, they're easily affected by these other variables. And those things are stress, trauma, and toxins in our environment. So when stress, trauma, and toxins affect the functional relationships and balance of the 3 fundamental aspects of health, then you are going to get something that we call malfunction, you know, malfunctioning of the system. And when the system starts to malfunction, it starts to develop a disease process. And this disease process starts as something really small, but then develops into something more significant. So first it's like a nagging symptom. You know, you're belching after you eat all the time. And then you're starting to have bloating and gas and not really feel very well. And then eventually you end up with an ulcer, you know, or something like that. So function leads to a disease process. And this disease process, it takes a long time to develop. And as a result, a lot of us don't even know what that is going on. So this disease process can be 10 to 15 years going on before you ever even know it. But one day you're going to wake up and you have symptoms. This is the case where someone says, I don't know what I did. I just woke up and I had this thing all of a sudden, it was so weird. Well, you didn't really just wake up with it. It's just you had a disease process going on for a really long time, and then like a crest of a wave, it tipped over, and now you have symptoms that you're experiencing. So this shows us that if we only treat the symptom, which is the specialty of Western conventional medicine, take a medication for the symptom, use a surgery for the symptom, then I don't think the outcome is going to be very good. And I see that in my clinic today. I mean, I can't tell you how many people come into the clinic with all of these things. They say, my blood pressure is controlled by my medication, my blood sugar is controlled by my medication, my cholesterol is controlled by my medication, my pain is controlled by my medication. I say, great, how do you feel? And they say, well, I feel like crap. That's really because they're only using symptomatic treatments. And the thing about your body is that if you ignore symptoms, then you're going to end up with a bigger problem, because symptoms, again, are a feedback mechanism that our body gives us to tell us that something's wrong. It's like our check engine light in the car. It comes on, it says something's wrong, take it in for servicing. And the challenge in this situation is that the service center doesn't really know as well as they should how to effectively resolve these issues. So what happens is the symptoms start to get worse over time until they actually can qualify for categorization as a Western medical diagnosis. And it's at that point that then there can be a treatment strategy using medications or surgery or something like that. So I think that if you really want to get well, you have to not only resolve the symptoms, but you have to get to the disease process and resolve that too. And when you actually resolve the underlying disease process that's going on in the body, you will restore functioning. And when you restore function, you will reestablish balance in the system and have true optimal health. So that is what we do in Chinese medicine. We use comprehensive treatment plans consisting of things like herbal medicine, acupuncture, dietary therapy, exercise, massage, and other treatment modalities to get people to this place of feeling the absolute best that they can and living the life that they deserve. So I'm excited to tell you all about this, and thank you for joining me today. And just let me know if you have any questions or concerns. Thank you.